Jay Coleman of Nutrition with Attitude, and today is a very special video. I'm here today with, introduce yourself.
Dr. Salome Masghati.
Dr. Salome Masghati. Okay, you hear that, people? We have a doctor here today. Can you tell your background?
So I'm an OBGYN, basically obstetrician and gynecologist. I'm currently in fellowship for minimally invasive gynecology, so focusing on gynecologic surgery. However, in my office, I see a variety of patients. I see pregnant ladies, I see young teenagers, I see older ladies, I see patients that are surgical candidates, I see everything.
Excellent. So you basically, thank you for that, you see a wide spectrum of people.
Mm-hmm.
All
ages.
All ages, you heard it. We're just going to jump right into it. We're going to talk about health. In your opinion, how do you feel about people shifting their habits in a different direction and leading a healthier lifestyle? Is it important?
It's absolutely important. There is not a day that goes by where I don't have a conversation about nutrition and exercise, basically healthy lifestyle with my patients.
Okay, healthy lifestyle. And why do you stress that to your clients?
Because it just impacts their health, and specifically women's health. So when it comes to women's health, as I said, I work with all ages. So when I have a teenager, a young girl who comes first for birth control counseling, and I see that she maybe has weight problems, often I see the association with depression, anxiety, and so I address her lifestyle together with the anxiety and depression that comes with it. So for a young patient, weight and nutrition and exercise is just as important as for my postmenopausal patients who have done this transition where their hormones have changed and they are entering a complete new stage in life, where we know that with the lack of estrogen, the fat distribution changes. So I have a lot of women who come to me just getting into their menopause and then telling me how they are gaining weight, and they're gaining weight in the wrong places, and they don't know how to address that. So I have my young patients and I have my older patients, and then I have my pregnant patients where weight is essential to control during pregnancy. As we know, obesity and diabetes during pregnancy are associated with worse outcomes for the baby and for the mother.
Oh, excellent. Thank you for pointing that out. Two things you said: obesity and diabetes. That is associated with what?
Basically associated with higher risk of C-section, morbidity of the infant basically doing poorly after birth, needing respiratory resuscitation, more admissions to NICU, which is the intensive care for newborns, also associated, and it's terrible, but also with infant death, either in utero or after delivery. And then also risk of shoulder dystocia, where when the fat distribution of the baby, especially with diabetic mothers, is mostly in the trunk and in the shoulders, those babies are at higher risk of having injuries during deliveries. So there's a lot of reasons why it impacts the baby, the newborn. But also we know that mothers who develop diabetes during pregnancy have higher risk of developing diabetes afterwards, because we call that gestational diabetes, but at a higher risk of developing type 2 diabetes afterwards.
And would you say that's tied in and has a correlation with diet?
Absolutely, I think that is essential. If you haven't had good habits before, it's gonna hard to make those changes. However, pregnancy, we know, is the biggest incentive to get healthy. For example, if I have a smoker, the highest chance for her to get off smoking or cigarettes is during pregnancy. So pregnancy is an amazing motivation for people to be healthy. A lot of women are scared to do a diet or watch their weight during pregnancy because they don't want that to negatively influence their baby.
So they have it kind of backwards. It's like, okay, when everybody says, oh, I got these cravings, I'm going to eat, they're eating these higher sodium foods, this can really be detrimental to the fetus.
Absolutely.
Okay, so what I get from this is that nutrition is very important. It's almost the crux.
Absolutely. And also, I'm happy you brought out those cravings. One of the biggest conditions during the first trimester is hyperemesis gravidarum, which means people are very nauseated.
Mm.
And we know that diet and nutrition is very impactful for that.
Yeah, my wife, you said before, I formulated a first, second, and third trimester plan, no nausea, no nauseation or anything of the sort. So I'm glad that you just touched base on on the board about nutrition, how important it is, especially for expecting mothers and people in general, and why obesity and why shifting habits is going to be beneficial in the long run.
And the fat cells that the baby develops in utero are going to stay with the baby, especially newborns as well and children. We know that the fat cells that you develop, you're never going to lose them, and you're higher risk for obesity if you're born already overweight, right? So weight control and healthy diet are absolutely important for our pregnant patients. But as I said, for all age groups, it just goes for everybody. So I'm just very happy to have resources for my patients.
Okay, excellent. And I'm just going to wrap it up here. You just went through my process.
Mm-hmm.
What did you think about my process? Do you think it's going to be beneficial? Do you think it's beneficial to you? Do you think it's going to be beneficial to just people in general? And why?
I think it's so fascinating because you just did my body scan and my composition analysis. And I'm someone who is petite, doesn't look very big, but I found out that I have a very high body fat mass. And the recommendation for me would be to lose a few pounds of body fat and build up muscle. I think this information is essential because these are things that you wouldn't find out for just like BMI or, just looking at yourself in the mirror. It doesn't really say a lot about how you are composed. And so I think the information you provided me with is much more detail oriented. And so there was a lot of my mind was blown.
Mine was blown. So you hear it, people. A doctor's mind was blown. Well, thank you, doctor. And thank you for coming here and explaining and touching the base on nutrition. And like I said before, just Jay with Nutrition with Attitude. See you on the other side. Peace.